So, we are going to cover this radiology X-ray of thoracic region. So, whenever you are given these X-ray plates to tell about the story about the X-ray plates, so there are basic principles that you have to follow, whether this X-ray plate is a normal X-ray plate or it's having any special character or not. So, how do you going to say that this is a general X-ray or a normal X-ray plate with a special X-ray? The whether you are seeing something special or not, that makes this particular X-ray plate is a special X-ray plate. That means normally we take the silhouette or these impressions of the like a bones, soft tissue structures, etc., etc. So, we cannot see the blood vessels, we cannot see this particular inside of this particular lumens of this intestine or anything which is related to this particular veins or etc., etc. So, if those things are visible in some of the X-ray plate, that makes this particular X-ray plate as a special X-ray plate. Otherwise, this X-ray plate we consider as the plain X-ray plates, which we are going to address. So, out here for this undergrads, we are just like giving this particular for this particular exam which we are going to face is the normal X-ray plate, which is not having any special characters. But having with this said this particular plates which you are seeing here is you are seeing here whatever the structure is in either these particular three shadows are there, black, white, and in between black and white we have the grey shadows. So, either three colors will be there in of it. Anything beyond that, if you have something seeing brighter or something which is visible on blood vessels, veins, etc., etc., that makes this particular X-ray plate as a special X-ray plate. So, whenever you are given this X-ray plate, you have to figure out number one thing is a general plate or a special thing. So, this thing is first thing you have to ask yourself whenever you are seeing it. So, it is a plain X-ray or it is a special X-ray. Once you see this particular X-ray plates is a plain X-ray or a kind of like a special X-ray, then you have to just like see about how we are seeing this particular thing. Whenever this particular X-ray plate pictures were taken, how the particular person was sitting or standing on that particular place. Like if the person which is standing in front or light is coming from front or the light is coming from back. So, that particular thing allows us to understand the views of the X-ray plate. So, whether this particular light which is this particular in this particular X-ray plate is that alpha rays or kind of like X-rays which is coming from that particular projectors is coming from front side or back side. So, that makes this particular view of the X-ray plates. That means how you are seeing this anterior posterior view, or if this particular rays are coming from the sides, we call them as lateral views. So, if you are seeing this particular X-ray which is showing the lateral profile of this particular individual, we call them as lateral views. If it is showing the some front side or back side view, we call them as anterior posterior view. If these lights are coming from the back side, we call them as posterior anterior views. Now, having said that views which you are seeing here, in case of the thorax, the views which you are seeing here, whatever I have projected out here is all of them are either anterior posterior view or posterior anterior view. That means the lights which is coming either from the front side or on the back side, right. In this thorax, otherwise it is given or anything is mentioned out here, the views which you are seeing here are posterior anterior view, also known as PA view. So, it is not a AP view in case of the thorax, we usually normally recommend to do it. We have a reason for doing this, the views as a posterior anterior view. What do you mean by the posterior anterior view is that assume this particular screen which you are seeing here, light source is coming from here like this, and I am standing in front in normal anatomical position, and this light is penetrating me and going back, it is captured on that particular film. So, this is how this particular projections is going on. So, if this particular machine is presented in front of me and the light is thrown, that makes this particular view anterior posterior view. It is capturing my anterior profile first, then it is penetrating and taking the posterior on the back side. That is how this particular picture is caught. Now, if the opposite thing is going on, I am standing here, this particular machine is placed on the back side and it is throwing lights which is X-ray in this particular case, and this particular film which is present in front of me, that means it is coming from my back side and moving forward. That means this particular view we call them as posterior anterior view. In short, we call them as PA view. Clear? Similar to it, if I stand on a side profile and this machine is on my side and this particular light is coming from the right side, is penetrating it and going on the side posterior to it, we call them as lateral view, because I am standing on a lateral positions, which is this particular film is revealing with this X-rays. It could be right lateral, it could be left lateral depending on which side I am standing. Clear? So, this particular views you have to see it. So, anterior posterior view or PA view. In case of this thorax, it's by default it's a PA view. So, whatever the films which are given to us to understand, to learn about is PA view. That means, what do you mean by the PA view? The light is coming from the back side, penetrating my body, and the film is on the my anterior to it. So, that is why it is going on the anterior side. So, it is PA view, that is how this light is coming, right? And lateral view will be likewise lateral views. Other than these two views, PA view and lateral view, we have an in-between view which is placed in this. We call them as oblique view. That means, is the light source is on the sides, I am standing here and taking a side profile or this 45-degree angle, if it is penetrating my body and taking a profile and taking the picture which is out here, we call them as oblique view. So, there are three views are there in this particular normal terms, that what we are seeing here. Posterior anterior view or AP view, that depends on how these lights are going, presenting my part of the body which I am going to show. Lateral views, from the sides the light source is coming, penetrating right lateral or left lateral, and in between the anterior anterior view and the lateral view, we have an oblique view which is penetrating on the sides or obliquely making a 45-degree angle, it is penetrating my body. These are the three possible views of human bodies. Normally, we ask you to understand and ask you to decode on it, okay, right. So, out here this particular by default in the thorax, the views will be PA views, unless until given something special, they will be mentioned on it. Until unless we take this particular views which is projected out here is posterior anterior view or PA view of thorax. So, whenever you are given this particular thing, you have to understand the first thing is that general or plain or special. Then we have the views, how these particular views we are seeing here, what are the anterior posterior view, lateral view, oblique view, etc., etc. That is what you have to figure out. And next thing is that once you have these particular views, what you are seeing out here. So, what is presented out here in that which region it is showing. So, if it is thorax, we have to mention that thorax or thoracic region. If it is whole of the thorax, it is whole of the thorax, we stop at that particular point. If it is abdomen, we say that this is abdomen. If it is upper limb, lower limb, etc., etc. And on that part, you have to just like say which subparts which you are seeing here. If whole of the upper limb is visible, we call them as whole of the upper limb. If it is half of this arm, forearm, hand, etc., etc. In case of the leg will be there as well, thigh region, knee joint, hip joint, etc., etc. Make sense? So, the part or the segment is projected out here, that particular segment which is your showing shape. So, in this particular view, we are going to see this is a plain X-ray which view, PA view of thorax or thoracic region. Then we come to see about what you are seeing on this particular picture. If you are seeing a picture like it has a trees, it has a house, it has a river, something like that. So, that is how we are going to say that. So, same thing out here we are going to say. So, we have this particular two elements is visible. One is the bony shadows, other is the soft tissue shadows. That means, we are going to see some bones and we are going to see some of the soft tissues. That means, other than bones, we have these muscles, all things together, they are known as soft tissue shadows. The soft tissue shadows are of two types. That could be muscles, that could be vessels, that could be something which is clumped together. We cannot differentiate the muscles with this particular viscera or muscles and the nerves or any kind of blood vessels on it in a plain X-rays or in a normal X-rays. Other than that, we may have some visceral impressions which we are going to see in some of these particular abdominal region, thoracic region. So, that particular soft tissue shadows we have to categorize. The soft tissue shadows of the muscles, soft tissues or blood vessels or vascular soft tissues or something related to the visceral soft tissues. That means lungs, heart, trachea, esophagus, intestine, stomach, liver, etc., etc. It is including like that, or diaphragm or etc., etc. This is how we are going to see. Now, take this particular bony shadows. Once we are demonstrating the bony shadows, what are the bones you are seeing here? That we have to mention. That I am seeing humerus, I am seeing clavicle, etc., etc. Now, if you are seeing this particular bones, we have to mention that part of the bones. See, the whole of the bones is visible or part of it visible. That means you are going to see the entire length of it or not. So, if it is not, you have just mentioned upper part visible, lower part is not visible, up to shaft visible, etc., etc. Medial side is visible, lateral side is not. That is how we are going to address that particular part. If that particular part of the bone is taking part in any types of joint formation or not, that means we have any joint figured out at that particular point or not. If that particular bone is making a joint like humerus making shoulder joint or clavicle making sternoclavicular joint, etc., etc. That's what you have to mention, that showing these joints, or if that joint is fully visible, we can say that the whole of the joint is visible. If it is not, we can say the part of the joint is visible likewise. So once we are done with the parts which you are going to see, that the bony part with this parts of the bones and these particular joints which you are seeing here, then come to the soft tissue shadows. If you come to the soft tissue shadows that I am mentioning here, if either it could be muscles, etc., etc., which you cannot figure it out, so muscular shadows or soft tissue shadows of the muscles or this particular neurovascular structure. Other than this, if you have the visceras or organ shadows of that particular region it contains. So in this particular thoracic region, we are going to see these particular skydiagram pictures. Then we have to figure out this particular basic element in here. So in this particular thorax, we have figured out we have two spaces existing on it, as far as visceral space or this particular content space is concerned. So we have a space on the right side and left side, we call them as pleural space, which holds this particular pleural cavity to it is lung. So we are going to see some shadows which is of the lung shadows, which is present on the right side and the left side, and in between the lung shadows right side and left side we have an in between space. We call this in between space between that as mediastinal space. So that particular mediastinal space, 90% of that particular mediastinal space is occupied by the heart or the structures which is getting in or coming out of heart. So the heart with the vascular structure is occupying the principal mediastinal structures. So that's what we are going to see. So whenever this particular soft tissue shadows we are going to address out here, we have to delineate the lung shadows. That means you are going to see the lung, you know the parts of the lung, upper part which is known as the apex of the lung, lower part we call them as base of the lung, which is sitting on this particular margins, we can see that as a diaphragm. So this lower part which has a diaphragm shadows, we have the upper part apex, we call them as apex of the lung visible. Then we trace the borders, like borders which is mediastinal border, inferior border of the lung which is visible or not. Now how we are going to see the lung in this diagram picture? So this particular X-rays are coming and penetrating our tissues. So these particular X-rays have the range of penetrability. That means if it is penetrating through the air, it do not have any resistance whatsoever. So it penetrates with 100% penetrability. That means it penetrates all the way. If it is getting some resistance, that means if you have muscles in between, it penetrates partly or penetrates slowly. If it is penetrating slowly, then it will taking some slow pictures. That means it is going to create some gray shadows. If it is completely penetrating, it is going to penetrating through the air, it is taking a black shadows. So if you have the air which is penetrated, that is going to take a shadow which is going to be the jet black or kind of like black shadows will be there. So that particular lung which is occupied mostly by the air, which is penetrated by this particular X-rays, is going to take a silhouette impression which is going to be the black shadows. If it is partially penetrated by some of the elements, we are going to see this particular element as opaque, or opacity will be there. That particular opacity will be maybe gray if it is a muscle, something like that. So if it is penetrating the bone, which is the dense most structure, so this particular penetrability of the X-rays is least through the bones. That means it is penetrating less. So that less penetrated structure is presented as a shadow which is whiter or brighter or ivory shadows, right? So likewise, we are categorizing this particular structure based on how that particular X-ray is penetrating it. So we have to understand this particular lung shadows. We have to identify the bony cages, ribs, vertebrae, whatever the things are visible, we have to identify as bony shadows as ivory white. Other than these, we are going to say target these gray shadows and black shadows, which you are going to see. This particular lung have got full penetration. That means that going to take some kind of black shadows. That black shadows is going to be the pulmonary shadows. The pulmonary shadows have the parts we are going to identify: upper end, lower end, medial side, lateral side, or mediastinal side, etc., etc. Similar to that, the heart, which has got like a pericardium, which is fibrous pericardium made of these particular tissues and the blood vessels present in it. So this particular element has got less blood, less air, and more blood and more soft tissue structures are there. So that means that particular shadows is going to take something in between this particular bone ivory white with this particular shadows which is present in this lung. That means it's going to be the gray white shadows which is penetrated as partially penetrated structure will be taken as the silhouette of the cardiac structures. So whenever you are going to see this particular three matters will be coming on to you beside this particular shadows interpretations. So lung shadows as we are going to identify, so you have to identify this particular skydiagram picture. Based on this, the views, etc., we are going to see. Now, other than this, whenever you are going to understand this particular element, there will be right side and left side will be there. So, if that particular areas is marked with this particular markings with this R or L like that, we are going to say that this is right side. If it is left side, will be L. So, if it is not marked with the right side or the left side, even though we understand very well this is right side, this is left side, we are not going to make a comment on it. So, this particular comment on this particular right side or left side is based on this particular leverage which is on the top side. Is R stands for right, L stands for L, will be there, has to be there. Then we are going to say that this is right side, this is left side. If it is not, even though we understand it fully with 100% accuracy and 100% confidence that this belongs to right side, we are not going to make a comment on it. We are going to say that we are going to comment on that once we see this particular thing when this particular person is taking the picture on. So, we have to mark it. So, radiologist or the technicians has to mark with this right side and left side, then only we are going to say that this is right side and this is left side, or else we are not going to address anything, no matter how, no matter good, we understand this. So, this particular X-ray, as we are seeing here, views, plates, what kind of things we are going to see. This particular black shadows is there, this is ivory shadows, and in between shadows which is mediastinal shadows. So, mediastinal shadows are which is penetrated by this particular structure which is medium penetrability. The bones which is present, which has ivory white, has a large presentations which is can be easily picked up by this particular bone shadows, and the black shadows have the maximum penetrability which is because of the air which is present in the lung, which can be easily identified. So, once we identify this particular lung shadows, we have to see that what particular areas we are seeing here, whether we can identify the apex, whether we can identify the base or not. If you identify the apex and the base, we can see these margins or not. That means mediastinal margin, costal margins, and as well as these particular angles. If you can see this, there are two kind of angles are there in case of the lung. We call them as the costal, we call them as pleural races. The races we talked about, there are two angles are there, costo-mediastinal and costo-diaphragmatic races, or the spaces there. That is radiologically mentioned as angles. So, costo-mediastinal and costo-diaphragmatic, which are the two angles. So, mediastinal will be on the mediastinal surface towards this side. So, this angle which is made by this lower end of the lung is costo-mediastinal angle, and other side which is to the periphery margin side will be costo-diaphragmatic angle, which is likewise. So, we call them as angles of the lung. So, these angles of the lung is clear or not. So, that means whether this particular angles is visible or not, that what you will be seeing in checking in each of them, here and here, here and here. So, this particular pleural races you will be addressing in here. That means coming to this particular margins over here. So, lung sitting on this particular shadows over here. So, this particular lower inferior margin you can trace it like this inferior margin tracing like this. So, this particular inferior margin also indicates the presence of some other structure as well. What structure is present under to this particular lung on which the lung is sitting on? The domes of the diaphragm. So, these particular domes of the diaphragm will be tracing it. So, this diaphragm is also visible at the inferior margin. If you see this particular diaphragm and the inferior margin, whether you see these particular margins are regular or irregular, that means it should be round regular, normally it should be. So, if it is having irregularity, that will be some abnormality. So, this particular regularity of this particular diaphragm or domes of the diaphragm need to be addressed. Then we move to the upper side, we see this apex. These margins we call them as mediastinal margins or mediastinal ends of this. So, this particular mediastinal ends will be visible as well. This particular area which you are seeing here is the costal or the sternocostal margins which is visible on here. So, these particular skygram plates, these lung shadows, we are going to understand and identify them based on this particular lung, how they are coming. Coming to this particular mediastinal shadows, as these mediastinal shadows are coming down, this particular region is taking a silhouette principally by this presence of the heart or heart shadows. So, these heart shadows will be present in here. So, this particular heart shadows out here you have to just trace it. Once you are done with these lung shadows, then in the heart shadows you have to trace three things. Again, just like lung, we trace this apex, we trace the base, we trace the mediastinal margins, we trace these particular angles. In case of the heart as well, we trace these particular three elements. We call them as borders of the heart. So, you have to trace the right border of the heart, we have to trace the left border of the heart. So, for that we have to need this particular markings which is present on it. This is R marked here, that means this is the right side, this is the left side, and based on that we trace this particular margins over here. This is the left border of the heart and this is the right border of the heart. So this particular right border of the heart, which is hanging down here, and as well as inferior border of the heart, which should be lying on here in the middle of this mediastinal surface, joining these particular angles out here. So this is the left ventricle, which is making an impression like this. It's the left side. This should be the right ventricle, which is arching over here, and this is atrium, right side. This side will be left atrium. How it is making out here. So this radiologically right border of the heart, you should be able to identify. Right border of the heart, you should be able to identify. Radiologically left border of the heart, you should be able to identify. These two borders along with this inferior border, which will be roughly like this, sitting on the middle portions of the diaphragm. So diaphragm have two domes, two elevations are there. In between we have this particular region, we call them as central tendon. On the central tendon, this particular inferior border of the heart is present. So this particular region has to be formed by this particular inferior borders of the heart. Apart from this particular right border of the heart, left border of the heart, we have a great vessel which is coming from the left chamber of the left ventricular chamber of the heart. We call them as aorta. So aorta have got three parts: ascending aorta, arching aorta, and then it is going down descending aorta. So as this particular arch of aorta, we mentioned about how this arching is going on. Is arching of the aorta is going from anterior to posterior. That means it's not from right to left. Rather, it is right coming from this particular climbing here and moving backwards. So as it is moving backwards, it's making an elevation, just like a hunchback. It is curving backwards like this. So this backward curving arch over here, making a elevation like this, looking like a knuckle of the fist. So this particular elevation, which is a knuckle-like feeling or looking like knuckle-looking hunchback, which is made by over here, which is done by this particular arch of aorta, as it is arching backwards. So this particular knuckle or elevation, we call them as aortic knuckle, made by this arch of aorta. So aortic knuckle, which is making a bulge over here with these markers, you can trace it. So these three elements, in case of this particular heart, you have to trace: right border, left border, inferior border, and the knuckle of aorta or arch of aorta. So knuckle or arch of aorta, nothing but the arch of aorta, how it is arching backwards and making an elevation which looks like a hunchback. So you have seen this fish well. So whale has a hunch on the back, is kind of elevated. So that hunchback on the whale, which is hunching back, so that kind of hunchback it is present. That's why it looks like knuckle. This particular knuckle is present in this particular region, you have to identify. So in this particular skygram picture, again you have to identify this particular soft tissue shadows, which is related to the lung, related to this particular heart, and related to the soft tissue diaphragm. Focus in here, which is coming from above. So again, this particular thin black line which is coming from above, also you have to understand. So this particular thin black line which is coming from here, which is nothing but another tube which is communicating the lung from this particular upper structure, which is holding the air as well. That's why it is taking this particular black shadow. So this particular black shadow, which is a tube-like structure present from here, which is the silhouette or the structure of the trachea, which is making her. So this particular trachea tracks down from this particular voice box. We have this voice box present in here, the larynx, the laryngeal cartilage which is prominent over here. So this is our voice box, our larynx are there. Our sound is produced in here. So this particular larynx or the voice box going down continues as a windpipe or wind tube as trachea. So that particular trachea has air in it. So this particular trachea, the thin tube's impression which is present in the midline is also visible in here. This shadow is made by this particular trachea which is present in here. And you can see this particular trachea which is present in midline and a little bit not exactly in the midline, it is shifted towards this particular sides of away from midline anyways. So this particular trachea which is present, and there is a physiological reason why this particular trachea is not present exactly in a midline. In physiology you are going to understand, in physiology you are going to identify the positions of the trachea based on this particular tracheal cartilages and this particular identifying it, this particular positions of the trachea. So you will do that exercise in physiology. So I am leaving that part for the physiology classes. So this particular soft tissue structures in this particular thorax you have to identify. So individually break down into smaller groups, identify this particular, each of these particular plates, split into 4 small groups, Identify each of these particular structures in this particular sciagram plates, 4 of them, whether you can understand this particular plate. Starting from the first thing is that whether this particular plate is a general plate or a plain X-ray or a special X-ray. Then you have to identify this view of the X-ray, whether you can understand the view which is present in thorax. By default, it is PA view which is given out here in today, and lateral view will be likewise will be given on the lateral views likewise. So these particular views that you have to understand. Then once we view these things which is view along with that, what are the areas which is projected in this particular sciagram picture. That means showing what region, that particular region you have to say. And on that particular region you have to figure out whether you are seeing some bony structure and soft tissue structure. If you are seeing some bony structure, what bone you are seeing at that particular, what bones are making what kind of joints in that particular region. Then we come into the soft tissue structures, that what soft tissue structures you are seeing here besides anything other than muscular structure. So if you are seeing some visceral structure, what visceral structures are there, and what visceral structure borders can be visible, like borders of these particular lungs or borders of the heart, how they can be visible. On other than this particular lungs and heart, if there is anything else we are seeing here, like diaphragm, trachea, etc., we are seeing here, right? So go into this particular sciagram picture, identify these particular plates, how we are seeing here, and see there whether you can just figure out this particular borders of the heart, margins of this particular lung, like inferior margin, superior margin, apex, base, mediastinal borders and sternocostal border, etc., diaphragm shadows, inferior border of heart, right border of the heart, left border of the heart, and then onwards, right? So you have 5 minutes time to figure these things out. Then I'll be just like throwing random questions. All right. Ribs ta konta dekha? Oglo ribs. Acha, ribs are oglo key margins. What margins you are seeing here? The margins here is the anterior margin of rib or anterior end of the rib or posterior end of the rib? Posterior end of the ribs. So this is a PA view. The ribs which you are seeing here, the shaft of it, and seeing the anterior end or posterior end that's commonly been asked. This is the posterior end of the ribs which is visible. Rib is counted from back to front. মানে পিছন থেকে সামনে counting হবে, ঠিক আছে? এরকম করে rib counting করি আমরা. So you count the ribs like this, not like this the impression which you are seeing here. This margin, whatever seeing here, is the posterior end which is ending on the vertebra. Okay? আর কি bones দেখা যাচ্ছে রে? What are other bones you are seeing? Scapula. আর কিছু আছে? Vertebra আছে? Vertebral shadows কোন জায়গায় আছে? Vertebra. হ্যাঁ, ওইগুলো vertebral shadows. ঠিক আছে? কোন joints? Sternoclavicular joint. বেশ, তাহলে ভালোই তো, পারছিস তো, চল। যাও পিছনে ওই লাল কি নাম? Identify the right border of the heart. Right border of heart. Identify. Heart. Right border of heart. Right border. घबराओ नहीं, कोई काटेगा नहीं. Right border of the heart. पता नहीं, इसीलिए तो पता करना है. Who can show right border of heart? Right border of heart. Right border of heart. Right border of heart. Okay. So how do you know right side? How do you know left side? Marking. What mark there? R. R stands for right. So what you are showing here? So you were showing previously that border left side. That will be left border of the. How do you know that's the left side? Mark there, left side. All right. So identify the easy way to identify right border half, left border half. Okay. Easy? So চলে আইডেন্টিফাই দ্য মিডিয়াস্টিনাল শ্যাডো। মিডিয়াস্টিনাল পার্টটা দেখা, কোনটা মিডিয়াস্টিনাল, যেখানে খুশি তোর যেটা ভাল লাগে। ওকে, সো ওইদিকে ফিরে দেখা। সি ইজ আইডেন্টিফাইং দ্য মিডিয়াস্টিনাম শ্যাডো। মিডিয়াস্টিনাম ঠিক করছে? মিডিয়াস্টিনাম, মিডিয়াস্টিনাম দেখা ভালো করে, ওই জায়গাটা বলছি। কোন জায়গাটা মিডিয়াস্টিনাম হবে? অন্য কোনো জায়গা হবে? হ্যাঁ, তো হ্যাঁ লাংসের মাঝখানটা হবে, তাই তো? তো মিডিয়াস্টিনাল স্পেসটা আইডেন্টিফাই করে এবারে। আইডেন্টিফাই দ্য মিডিয়াস্টিনাল স্পেস, ওই জায়গাটা। তা বাউন্ডারিটা কোন জায়গা হবে? কোন জায়গা থেকে কোন জায়গার মধ্যে? হ্যাঁ, মিডিয়াস্টিনাল স্পেসের বাউন্ডারিটা, মানে এক্সরেতে এখানে যেটা দেখতে পাচ্ছিস ওইটা। হ্যাঁ, সো দ্যাট পার্টিকুলার স্পেস বিটুইন দুটো লাংসের মিডিয়াস্টিনাল বর্ডার গুলো বলো। সো আইডেন্টিফাই দ্য লাংস মিডিয়াস্টিনাল বর্ডার। চলো, ইউ কাম হিয়ার। Lung mediastinal border. Borders. Okay. Superior. বেশ, ওখানে superior and lateral margins of mediastinum. কি বলে কোনটা হবে? mediastinal space কোনটা? পুরো জায়গাটা মানে ডিফাইন, ইউ হ্যাভ টু ডিফাইন দ্য স্পেস, রাইট? সো ইউ হ্যাজ টু হ্যাভ এ বাউন্ডারি, রাইট? এরকম তো হবে না যে তুই mediastinal space দেখাচ্ছিস that is expanding or like that. So you have to define the space. So every space has a point, like from here to here, above, below, right to left, like that. So you have to just like figure out the space which is present on it. So how you going to identify this space is mediastinal space. Behind the two lungs? Between the two lungs. Okay, between the two lungs. Then show me the between the two lung space. This space. So what is the lateral borders of it? Konta? So trace it above down. Yes. Simple thing. So you have to identify the space right, left, above, below, right? So that's the space, mediastinal space. Okay, that's it. Good. Darun. Chalo. Okhoga. Chalo. এই দ্বিতীয় পিকচারটা aortic knuckle, সেকেন্ডটা। হ্যাঁ, aortic knuckle. Aortic knuckle. How this aortic knuckle is formed? Arch of aorta. What are the parts of aorta? So which part is forming this shadow? Arch part. How about ascending aorta? Not. Descending aorta? Not visible. It will be falling back. So we cannot see that. Only we can see the arch of aorta, which is arching front to back, is visible there. So which is a carved structure. Looks like a knuckle, hunchback. That's why you call them as knuckle. Aortic knuckle. Right? চলো, দারুন। ভালো শিখে গেলি। ও খোকা, ওই যে মাঝখানে তোর পিছনে, ওই যে না ওই যে তুই পরে পারবি। এই যে চলে। Show me the costo-mediastinal recess. খুব কষ্ট করে বার করতে হবে। costo-mediastinal recess. আর তুই চলে আয়। হ্যাঁ, তুই আরেকটা বার কর, costo-diaphragmatic recess. তোরা দুই ভাই দুটো রেসেস খুঁজে বার কর। costo-mediastinal recess আর costo-diaphragmatic। তোরটা কি? costo-diaphragmatic আর ওটা mediastinal। ওকে, কোনটা costo-mediastinal? কোনটা? ওইটা। আর এই লাংসের কোনটা? এইদিকে না 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 ওই ডান দিকের লাংসটা কোনখানটা হবে কষ্ট ওইখানটা কি হবে ওটা কি মিডাস্টিনাল কষ্ট করে মিডাস্টিনাল খুঁজতে হচ্ছে তোকে দেখলি কত কষ্ট পেতে হলো কি বলে ওটাকে আর কষ্ট ডায়াফ্র্যাগমেটিক রেসেস ওইটা এইদিকের হ্যাঁ ওইটা তাই তো এগুলোকে কি বলে রিসেস রিসেস মানে কি স্পেস স্পেস জায়গা ঠিক আছে কষ্ট মিডাস্টিনাল রিসেস আর কষ্ট ডায়াফ্র্যাগমেটিক রিসেস ঠিক আছে পড়তে হবে তো পরীক্ষা দিস নি কেন পরীক্ষা দিস নি কেন কে ঘুমাচ্ছিলিস এবার পরে পরীক্ষাটা কি হোস্টেলে কি নেবো তাহলে ঘুমও ভাঙতে কষ্ট হবে না দরজা লাথি মেরে তুলে দেবো পরে পরীক্ষা দিবি आ जाओ आ जाओ तुमको भी नायिका बनने का मौका मिल रहा है identify the tracheal shadow so that tracheal shadow will be midline on top of this particular inlets of the larynx or superior thoracic aperture that will be making but कैसे दिखता है white दिखता है कि black दिखता है black दिखता है क्यों black दिखता है why it is looking black क्यों लंग्स कैसे दिखता है ब्लैक लंग शैडो ब्लैक क्यों वाई एयर की वजह से क्या होता है एयर ब्लैक होता है क्या काला एयर होता है क्या पोल्यूशन से काला है कि कैसे काला है वाई इट इज शोइंग ब्लैक वाई इट इज शोइंग ब्लैक एयर की वजह से क्यों काला होता है नहीं पता why it is showing black কি হবে হাওয়ার ভেতর দিয়ে পাস করে যাবে তার মানে কেন পাস করে যাবে কোনো অবস্ট্রাক্ট করার কিছু নেই কেউ বাধা দেওয়ার কেউ নেই তাই তো so if it is penetrating completely passing through air it is not going to create some kind of impression right ওকে ওকে অপরাধীর মতো দেখাস না ভাই তুই অন্য কাউকে দেখা বলবে যে পানিশ করছে হ্যাঁ তুই অন্য কাউকে দেখা আকাশ বাতাস কিছু দেখা so if it is completely penetrated the particular structure if it is filled up with air which has got maximum penetrability it is creating no shadows whatsoever it is running through that's why it is going through an air shadows which is going to make the black shadows if it is penetrating some resistance or if it is getting some resistance penetrating partially it is going to create some shadow we call them as gray shadows and it is not penetrable or hardly penetrating it is going to make some shadows which is dead end shadows or ivory white shadows like bones so depend on penetrability of this x-ray rays we get these three kind of shadows full penetration partial penetration no penetrations or least penetrations acha theek hai aa jao so these are the things which you have seen identifying this right border left border etc knuckle so you see this particular lung shadows within this particular lung shadows you see some kind of like a whiteness is there that kind of whiteness is not kind of like a localized it's kind of like a scattered sparse it looks like something there which is going on so this thing we call them as markings is called them as bronchovascular markings this bronchovascular means the lung is getting the air through the pipes we call them trachea which splits down into the bronchus which brings down into bronchus bronchioles etc etc so those things are going in so those structures are going to make some impressions within the lungs whenever it is penetrated by and as well as it has blood vessels pulmonary vessels arteries bronchial vessels arteries they are also there so those bronchovascular elements are making some kind of impressions on here so which is visible on this particular rays like structures like this it looks like a leafy or leaf kind of things which is present it's not like jet black so we can see this particular white element which is because of the bronchus or splitting of the bronchus blood vessels which is going in so we call them as bronchovascular markings we call them as bronchovalvular matrix. This is a lung shadow or lung parenchyma into which through the hilum these things are going, the bronchus, bronchioles, etc., the blood vessels, which is going to get inside. That particular shadows are also being presented whenever this particular thing is penetrated. So these markings are visible because of this. Along with that, we have some lymphatics present in the lung. We call them as pulmonary lymphatics. So those lymphatics also present some kind of markings. So which are going to make some kind of white shadows, which is looking like a branch trees. So which is making some markings, we call them as bronchovascular markings. So this outlines of the lung which is visible into which the white tissues which you are seeing here in between, we call them as bronchovascular markings, right. Now within this particular mediastinum, this particular space we call them as mediastinal space. Right away over here in this region we have some kind of region, we have the lymphatics which is related to the hilum of the lung. We don't remember the hilum of the lung, which is roughly related to the middle portions of this particular mediastinal surface. So this region we have lymphatics. If it is present, we call them as hilar groove of lymphatics or hilar lymph nodes by the hilum. So this hilum or hilar lymph nodes are there, which you are seeing here as this particular markings. So here we have this particular irregularity marked by this particular lymphatics along with this particular bronchus, which is splitting down with the principal bronchus, segmental bronchus, etc., going in along with the blood vessels which is present. We also have some kind of intrapulmonary lymphatics as well. So lymphatic channels are also there. So they are basically together making this particular lung shadows, black shadows. Within it, we see some kind of markings. We call them as bronchovascular markings. Clear? So this end, apex, base, inferior border, mediastinal border, margins of the lung which is known as costal margins, so which is going on this costal side, recess, this is one, mediastinal, diaphragmatic, inferior border which is related to this particular heart in the middle, and this side is the domes of the diaphragm. The heart shadows, borders of the heart, right border, left border, inferior border, knuckle, trachea, and this particular bony shadows and with these joints which are present. Clear?